I don't know why they're
I apologize for getting started a little late, but we're well organized in our solutions. My name is Catherine Dolan, and I'm Director of the Buffalo Center for Social Research in the School of Social Work at the University of Buffalo. And on behalf of the faculty and staff and the folks at the center and Dean Nancy Smith, we welcome you today to our Distinguished Scholar Series. The center started these in 2005 with the support of Dean Smith. We offer 2 a year, and twice annually we bring in a distinguished scholar on a variety of different topics and offer it free of charge to the community, both our university community and our Buffalo area, Western New York community. And so we welcome you, and we're pleased you're here today. What we're going to do is have presentation, lecture, discussion, chat with Sarena Seifer here shortly from about 2 to 4, then I know I'm getting started a little late, followed by a reception in the room next door. So please join us afterward. We can continue to have some of those conversations and dialogues you all started while you're waiting for me to get up here. So thank you for coming. One of the things that I'm excited about this time is that we've never had anybody co-sponsor the event with us. And because of the topic, the Office of Community Relations at the University of Buffalo asked if they could join in and co-sponsor the event. We brought Sarena in for a 2-day event, and this is the first day of it, and there's some things going on tomorrow as well. So I'd like to introduce Des Clark. He's Director of Community Relations here at UB, to come up and he'll introduce our speaker today. Thank you.
That was a very polite applause. You haven't met me yet, so I'll try not to ruin it. Good afternoon, everyone.
Good afternoon.
I'm more spunky than that. Good afternoon. I had a late night last night, so. So I'm very energized. Again, just briefly, the Office of Community Relations is proud to sponsor this very important dialogue, have an opportunity to learn and grow. And so we're very pleased that you are here, Dr. Seifer. Dr. Sarena Seifer's work focuses on the principles and best practices of partnerships between communities and higher education institutions. She served as the founding executive director of Community Campus Partnerships for Health from 1997 to 2008, and is now a senior consultant for the organization. She is also a research associate professor in the School of Public Health and Community Medicine at the University of Washington. As executive director of CCPH, she led a series of national initiatives in service learning and community-based participatory research, including the Health Professions in Service to the Nation program, Partners in Caring and Community, Service Learning and Nursing Education, Community Engaged Scholarship for Health Collaborative, Health Disparities Service Learning Collaborative, and the Faculty for the Engaged Campus. She continues to consult on the latter 2 initiatives and is co-principal investigator on the study Understanding Community-Based Processes for Research Ethics Review. She also coordinates the merit review process for the Healthier Wisconsin Partnership Program. She's very busy, ladies and gentlemen. Sarena is a graduate of Washington University in St. Louis and received her master's degree in physiology and her medical degree from Georgetown University School of Medicine. After completing her medical education, she served as the American Medical Student Association's Legislative Affairs Director and subsequently as founding director of the Center for Health Policy Studies. In 1995, she completed a postdoctoral fellowship program in health policy at the University of California, San Francisco's Center for Health Professions. Prior to her fellowship, she was a health policy analyst for the Washington State Senate and director of recruitment and retention for Northwest Regional Primary Care Association, a membership organization of community and migrant health sectors. Ladies and gentlemen, please join me in welcoming our special guest for this year's Distinguished Scholar Series, Dr. Sarena Seifer.
It's really a
family also, and it was really a thrill to be back in the U.S. for the election. I know the Canadians very much were excited to see the outcome as well, but just to be here to witness that historic event was really very special. And it's a pleasure to be here today. I want to thank Catherine and Vince for inviting me and supporting me to be here for a couple days with all of you. I've had buffalo wings. I've had roast beef with on wet. I'm getting to know the local cuisine and meet all of you wonderful people here in Buffalo. So what we're going to talk about today in my presentation is how community university partnerships, how partnerships that bring communities and universities together can be instrumental in solving our persistent social, economic, and health problems. And to sort of paraphrase our President-elect, we all need to come together to really move this country forward. And by all, we mean all communities and all institutions. And universities, I think, are very special anchored institutions and communities because they are grounded in a specific geographic place with connections through students, faculty, and other resources to the larger community, and are places where knowledge and wisdom from community and university can come together to make change. So, and I am also excited about our next president because his wife, I don't know if you're aware, but she directed a community university partnership initiative at the University of Chicago and very much supported community engagement of universities. So I think the future, may be bright for this sort of work in the next administration. What I'm going to talk about a little bit is just give you some background on the organization, Community Campus Partnerships for Health, because that's a large part of the foundation for the work that I'm going to present today. And then go over kind of what is the current state of these sorts of partnerships. There are many out there right now. It's a growing phenomenon in the U.S. and in Canada and other countries as well. What is the current state? What do we know about these sorts of partnerships already? And then discuss a framework and principles for how these partnerships can be truly authentic and transformational. And I'm going to give you a couple of examples. These are two examples of partnerships that were awarded the CCPH Award. We give out an annual award to an exemplary community university partnership. And they're just examples. I'm not describing them because they're the be-all and end-all of what these partnerships can be. There are many ways that these partnerships can play out on the ground. But I think they're two good examples that illustrate some of the points that I want to make. And then a little bit on what communities and campuses can do to develop and sustain these sorts of partnerships. And I guess I would also say, I know this is sort of a lecture-style format here, but if you have a question or if I say something that you want to ask about or challenge or make a point, just raise your hand or scream it out if I don't see you. It's perfectly fine. You don't have to wait till the end. So CCPH is an organization that was founded in 1996, early 97. So it's been around for quite some time now. And the mission, the whole focus of the organization is to promote health broadly defined by bringing communities and academic institutions together in partnerships. And we added a couple years into the organization that parentheses broadly defined because I want to make it clear that we're not just talking about health in kind of a narrow clinical one-on-one patient care sort of way, but the health of a community more broadly, social, economic, spiritual health of a community and of the people that live within it. And so with that definition, we're really trying to promote understanding and addressing the root causes of problems. And certainly direct patient care is a part of it, but it's not the only determinant of health. So I just wanted to make that clear. And CCPH is a nonprofit organization. For many years we were based at the University of Washington, and that's where I was based as its director. And when I decided about a year or more ago to step down from the position, the board did a national search to find a new executive director and a new organizational home. And so now it's moved to Milwaukee, Wisconsin, under the leadership of Cheryl Marana at the Medical College of Wisconsin. So that's where we're based now. It is a nonprofit with its own board. We've been based at a university because it's been a good partnership to have the resources and connections to students and faculty and other resources at the university, but it does make its own decisions as a nonprofit. And we are a membership organization. We have about 1,800 members and a number from here in Buffalo that are involved in the organization. And it's both community and campus membership. which I think is also important to point out because it's not a maybe traditional professional organization that may represent a particular profession or discipline in higher education, but it's open to community and campus. These are some of the goals of the organization, just to give you an idea of why we exist, what we're trying to accomplish, and these are goals that really have been there from the start. One very important one is we very much believe that in order to address any complex problem in a community, you need to bring the wisdom and the knowledge together that academics have and that communities have. The theory, the practice, the real-world experiences that people have on the ground, all of these are needed to address these challenges. We have a very strong goal around building capacity, how to prepare communities, how to prepare faculty, how students can gain the skills and knowledge to be able to work effectively in these partnerships. We want to especially support communities in their work with academic partners and recognize and reward faculty for doing the work that they do in the community, which is often undervalued or not viewed as genuine scholarship or as central to the mission of universities. We have a goal of developing partnerships that are equitable, that share power and resources among all those that are involved. And this last point I think is very important because for these partnerships, we're working in the community to really have value and to have a lasting effect. Some sort of social change, some sort of ultimate change needs to be focused. It's not just to do a project, or it's not just to volunteer in a homeless shelter, or it's not just to ensure that people get access to certain services in a community. Those things may be important first steps, but ultimately, are we overcoming homelessness? Are we creating a national health system where everyone has access? What are the ultimate objectives of the work? It needs to be about that social change. So what is the current state of these kinds of relationships right now, of community-university partnerships? These are kind of the bottom line points, I guess, to the next couple slides that I wanted to share with you. One is that, particularly over the last 10 years, there have literally been dozens of reports from national organizations, from national bodies, calling on universities to be more engaged in the community, to be more responsive, to be partners in their communities. The number and range and scope and benefits of these partnerships has been growing. The funding for it, I'll show you some slides about this too. It's diverse and it's growing. This is a phenomenon that is becoming more prominent and is, I believe, a movement in this country. But the predominant model, and I'll describe this in more depth, is not really a partnership. When you really look at a lot of the work being done between communities and universities, whether it's research-focused or students involved in community-based learning experiences, the predominant model, and there are exceptions of course, but the predominant model is still very driven by the academic goal and very much by the institution and not being driven by the community or equitable in its nature. But we're learning a lot about what works and what doesn't work, and that it is possible to achieve a more authentic, balanced relationship. And there are challenges to this work, but also recognized success factors. And I hope one point that comes through, this isn't designed as a traditional sort of research talk. I do have some references at the end if people are interested in obtaining some of the literature that I'm basing this presentation on. But there is a growing evidence base to support the rationale and the practice of these sorts of partnerships, and I think that's important. So in terms of the current state, these are just a list, not quite random, but I tried to pick a few representative reports that have come out over the years about community-university partnerships. I don't know if you're familiar with Wingspread. There's a foundation in Wisconsin called the Johnson Foundation, and they have a Wingspread conference center there. It's a foundation that doesn't give out grants, but what it does is provide its resources, its conference facilities for important conferences. As I understand it, National Public Radio was founded out of a Wingspread conference. The National Endowment for the Arts grew out of discussions that happened at a Wingspread conference. So it's that kind of retreat environment where new ideas can flourish and be born. And there have been a series, a couple of the bullets up here are Wingspread meetings that brought together university presidents, faculty, community partners from around the country to discuss the future of higher education, the future of universities, and they came out with a number of statements advocating that universities reconnect with their civic mission and become more engaged. There are a couple of other commissions. The Kellogg Foundation has been a really big investor in this sort of work. Several commissions they've funded have advocated that state universities, land-grant universities, health professional schools become more community engaged. So just to give you an idea of what's been proposed by a number of groups. And many of them have focused on this concept called the engaged campus. And this is a definition here. There are a number of them, but they pretty much say the same thing. This is from Campus Compact, which is a national organization of college and university presidents that have made a commitment to community service and engagement in their institutions. And what it says, I'll just read it, the engaged campus vision expands the scope of work from student involvement in service and service learning, which are important, but it expands the student connection to the community to campus-wide involvement in community partnerships. Service and service learning remain crucial to educating students for lifelong informed and active citizenship, yet those strategies are only two of the many possible ways that campuses can and do collaborate with their communities in order to promote positive social change. And what I like about this definition and this concept of engaged campus is it is saying the campus as a whole has resources that can be brought to bear in communities. Students are an incredible resource, and that's part of what they have to offer and what the connection can be. But it's not only about students. There's faculty, there's buildings, there's economic potential, there's real estate development, there's purchasing power. You know, universities have all of those resources. And in fact, in 1997, the conference that launched Community Campus Partnerships for Health, we had a keynote speaker by the name of John McKnight. Some of you may be familiar with his work on asset-based community development. He looks at communities from what are their assets and strengths, not only what are their needs and deficits and problems. And he led the group at the conference in an exercise where he asked people at tables like where you're sitting, round tables, to come up with, well, what are the assets that universities have to offer? Like, what are the assets? What are the strengths? And as you can see, there were a whole variety of things that were mentioned. Many of them with, actual examples that people had to offer of when universities made these resources available to the community. Human resources, services, facilities, economic and emotional resources, equipment and technology, policy and advocacy, cultural events, and things of that nature. And so I think it really helped us in thinking about the engaged campus when you start to break down, well, what all is available in an academic institution that could be a resource and an asset in a community. And the engaged campus, this concept also follows kind of a continuum along a number of dimensions. So in other words, it might be that the first notion of working with the community is to provide service or to provide some sort of charity in the community. And then maybe it evolves into a project where you're trying to get something done, some particular change in a community. But ultimately, as I described earlier, it's not just about conducting a variety of community projects, but getting at the root underlying determinants of what the issues and the problems are. And that is really what gets you to the social change. It's also evolutionary in terms of you can have community-oriented programs where students and faculty perhaps go out and conduct a project, but there's no partner necessarily there, no community participation in the decision-making and the design. But over time, if it can evolve to be more of a partnership where the community is involved in a decision-making and partnering role. The engaged campus also takes the three traditional missions of universities, research, teaching, and service, and kind of adds a fourth dimension, if you will, of being a citizen, an institutional citizen. What does it mean to be a university engaged and active in its community? It can involve teaching and research and service, but there are many other ways that institutions can invest in their local communities. And I mentioned earlier things like real estate development, purchasing, construction. These are all ways that institutions have economic power. Now, they could be incidental sorts of things, but if they were more strategic and deliberate of how we're going to, when we build our new dorm, we're going to think about mixed income housing at the same time, the way Northeastern University has done in Boston. or when we build new facilities, we're going to think about community space that community groups can meet in on the hours when classes aren't being offered, the way University of North Carolina Chapel Hill has done. When you start to think that way, there are many more ways the university can be an asset that might not be so readily apparent. And then also, this notion of an engaged campus takes you from what in many institutions is very fragmented activities, and they're all wonderful, worthwhile activities in and of themselves. But when you have faculty and students in various parts of a campus doing things in the same neighborhood, and they're not connecting and maybe strengthening their efforts by working in an interdisciplinary way, that's not the same as an engaged campus where there's strategic collaborations going on for a specific purpose in a community. So the engaged campus, I think this concept is an evolutionary way of thinking about these relationships. And Campus Compact, the group I mentioned earlier of university presidents, they've come up with a set of indicators of an engaged campus. So in other words, how would you know one if you saw one looking at a university? And I think these indicators have held up pretty well in studies of community engagement, that if the mission and purpose of the university is clear and has a connection to the community, which frankly most do in some way in their mission statement, but they have administrative and academic leadership who not only talk about community work, but invest in it and support it, and it's central to the mission and the way they view the institution, that there's an explicit connection of community work to teaching and research. Because let's face it, the primary mission of universities is teaching and research. I mean, service is there as well, but the real coin of the realm in academia is the teaching and the research missions. And unless the community engagement is integrally tied to those core purposes of the university, then this will be an ancillary kind of extra add-on thing. But in an engaged campus, you're going to see many courses with service learning experiences for students where the community engagement is a natural part of the courses that they're taking and the degree requirements. You're going to see faculty who are engaging in research studies with community partners. That's not something extra that they do on the side, but is an important thread for their scholarship. Those kinds of things. You're going to see those explicit connections. You're going to see internal and external resources that are allocated to the effort, so that when budget times are tough, this isn't the first thing that gets lopped off. It's so embedded in the institution that it's a part of the budget process. It's a part of what's considered central. An example of that would be Portland State University, which under the leadership of Judith Ramaley, this is going back about a decade now, really reinvigorated this institution on its urban mission, and it became focused from the curriculum, from the research, from its design of new buildings in the downtown area. This notion of community engagement was central to it, and now there's been at least 2 presidents that have taken over that institution since she left, but it became so embedded in the curriculum and in the research and in the promotion and tenure guidelines also, which they're noted for. It won't just go away. It becomes part of the budget and allocation of resources within the institution. Other indicators of engagement, you'd see disciplines, departments, interdisciplinary work focused in this area, and it would be widespread. It wouldn't just be, oh, they do that in social work, but they don't do it in the other parts of the university, or, oh, yeah, that's public health that does community engagement, but not engineering and not the law school. In an engaged campus, you'll start to see these happening in many different disciplines and departments because they see it as integral to the teaching of students in those fields, and they see it as integral to answering important questions, scholarly questions in their field. Another indicator is you'll see faculty development and roles and rewards that are consistent with this kind of work, so that in advertisements for new faculty positions, for example, it will be expressed that we're looking for somebody who knows how to connect with communities, who does community partnership work, who knows community-based participatory research, for example. And it will be reflected in the promotion and tenure, not just on paper, but in the way they're applied in practice. In an engaged institution, you'll see community and student voice present in the institution, that it's not just about sending students and faculty out, but there are agency directors, community-based organization leaders that have adjunct appointments, that are teaching in seminars, that are co-teaching courses, that sort of thing. You'll see enabling mechanisms. Excuse me. And what I mean by that is, and this is something that's really becoming more common now in universities around the country, is setting up structures to help facilitate community-university partnerships. It could be the center that's at the University of Pennsylvania that serves this role. At the University of Washington, they have what's called the Charleston Center. A lot of these centers are named after wealthy alumni who've donated to help support the startup of these centers. But the focus is a campus-wide mechanism for developing community relationships, helping faculty navigate the community, helping students find placements for service learning, that sort of thing. But those mechanisms can really help to sustain a campus-wide involvement. And then finally, an important indicator of being an engaged campus is that you'd see sustained, mutually beneficial relationships with community groups and community organizations over time. That it wouldn't be every semester, every quarter, there's a new set of partners at the table because every class is a different, it has different placement sites, or research kind of goes from one topic to the next and the partnerships aren't sustained. But in an engaged campus, you would see that kind of sustainability. So why are we even talking about these issues? Why are community university partnerships even on the radar screen? Why the engaged campus? Why now? And there really are a lot of reasons, and I don't mean to keep quoting our president-elect, but I think the points that he makes about the importance of community organizing, the importance of community development, the importance of partnerships to actually create change are very much central to why we're talking about this now in higher education. Universities have a traditional, when you go back to the history of universities in this country, there was a tradition of having a moral and public purpose for education, knowledge for action, and knowledge for change. And the public is, I think in many ways legitimately cynical and critical of major institutions that seem to be disconnected from the day-to-day problems that they face. Whether that's an attitude towards government, which we've seen in this last election, or an attitude towards universities that can often be viewed as very ivory tower and disconnected from real-life problems. And this is a way of reconnecting and being more accountable and valuable. Higher education is a huge economic asset in terms of billions of dollars spent on education, in terms of the economic potential of the graduates. And that's another reason why particularly state legislatures and communities are eyeing institutions, universities, as important vehicles for change. Preparing graduates for practice. Almost any field that you could just throw out, or discipline that you might throw out into the conversation, is enhanced by having experiential community-based learning. Certainly in the health professions, in social work, in public health, in engineering, in law, any of these fields, how can you practice effectively as a practitioner, as a professional, without having that practical experience as part of your education? And I think there are more and more disciplines and fields that are recognizing you need to have an experiential component and a community component to graduate and be effective in the workplace. And that's been a major driver, particularly around service learning in universities. So those are some of the reasons. And then, of course, funding agencies, I think, and I have a slide with a few of them listed, but more and more funders are starting to realize that if they really want to see change, long-term change, they need to see partnerships and they need to see universities and communities coming together to create change. And that's, of course, an important driver of institutions that are so dependent on outside funding for their work. So when you look at the landscape of community university partnerships around the country, this is a list of, and I could add to it, but it's already a pretty busy slide, of all the different outcomes and goals that these partnerships have. They're being applied in so many different settings right now. In the work that I do most closely is around racial and ethnic health disparities, and we have an initiative right now that's working with 7 schools of public health that have developed community partnerships to help educate future public health practitioners to be effective in communities around reducing racial and ethnic health disparities and addressing the root causes of those disparities. But also there are initiatives, community university partnership programs to increase the diversity in the workforce, to close the achievement gap in public education, to increase quality affordable housing, to revitalize cities, develop rural economies. I mean, virtually any public problem that you could identify, there's an initiative that's honed in on how do we get the community university people working together to try to address this problem? When I say university, I also mean community colleges and colleges, not only universities per se, but higher educational institutions as vehicles for change. Yeah, there's a question.
Where are the healthcare organizations at in this mix? Are they engaged at this point, or is that an objective down the road?
Do you mean are healthcare organizations engaged in these kind of partnerships?
This organization actively engaged with the healthcare organizations in the Buffalo area?
Oh, CCPH is an organization, do you mean? I'm just trying to... I know we have members here that are part of the University of Buffalo and also from some community organizations. I don't know if Bruce Nesbitt's here from Spectrum Health, but we do have members that are from community and academic organizations. But I think from... and maybe Catherine or Vince could speak to it, kind of what partnerships are going on currently in the Buffalo area, because I'm not as familiar with what is happening right now here. I don't know if you want to speak to anything that might be going on in health.
Yeah, and I'd love to know more specifics about questions, but there are myriad examples of university involvement in the healthcare industry in Western New England, including providing free healthcare on the east side of Buffalo to research initiatives with community-based organizations, campaigning around studies campaigning cerebral fatigue and health issues associated with it. There's a number of examples of where the university is actively engaged with healthcare organizations and community organizations around
Yeah, and I would say for those of you who really want to learn more about what's going on right here in this community and in this institution, to stick around for the reception, because that's going to be, I mean, the Q&A we may get at that, but it's also a chance to really talk to people more about the work that they're doing. I mean, obviously I'm learning while I'm here all the work that's going on locally, because I'm not based here. And in terms of the methods and approaches that these partnerships are using, service learning is one particular approach where students are engaged in the community as part of their education, providing service and learning at the same time. Community-based research and participatory models where community members are involved in designing and implementing research studies, that's another approach. So there are different ways. You know, one thing that I'm not saying up here is that there's one particular model, one particular way to do these kinds of partnerships. But there are actually many approaches that can be taken. There's also some data. Campus Compact does a survey annually of its members. It has about 1,000 member universities. And I think this is also just another way of demonstrating the growth and the prevalence of these sorts of partnerships, that 98% of their members have service learning courses, and that have partnerships with a variety of organizations. And it looks like the more common are nonprofit groups, K-12 schools, faith-based organizations, churches, and so forth. They've estimated, this is a couple years old now, so I think the number's higher, but about $4 billion a year in service being provided through students that are doing service learning courses and community service activities. There's been a dramatic growth. I mentioned this earlier, some of these enabling mechanisms, structures that campuses put in place to help support community university partnerships. And then funding. Kellogg has been really a major investor in this whole concept of community university partnerships, both in health and in other areas in higher education. But there are other funders like the Casey Foundation and the Robert Wood Johnson Foundation, public funders, the Centers for Disease Control, NIH, National Institutes of Health, is starting to really invest more in community-based participatory models of research. And for any of these funders, it's not, the predominant, it doesn't represent the majority of their portfolio. I mean, certainly NIH still, it's primarily biomedical research, more narrowly defined, that is their primary investment. But they're starting to see the benefits of other models and other approaches that occur in collaboration. CNCS is the Corporation for National Community Service. That's a federal agency that specifically funds service learning in higher education and also community-based research.
And Housing and Urban Development funds community outreach partnership centers, has funded them in the past, and has other mechanisms for community university partnership funding. So it's all part of, I think, this climate out there of we have shrinking resources, we have more intractable problems, how are we going to solve and address them, and communities and universities working together can be more effective than trying to solve these issues on their own. In terms of recognition, I wanted to mention there are a couple of national awards and recognitions that are also playing a role in culling out these examples and getting universities more engaged. The President's Honor Roll, there's an actual award that's given out every year to universities that are community engaged that comes out of the federal government. And then you may be familiar with the Carnegie classification. There's a classification system for universities based on what kind of university they are, if they're research intensive, if they're more teaching oriented, if they offer doctoral degrees and comprehensive degrees. And a couple of years ago, they added a new classification for community engagement. And so universities have to apply to be designated, and they have to document that they're doing this work. But over 100 universities have been awarded this designation for demonstrating that they are engaged. And I think just having that classification is getting many institutions to look at themselves differently and think about, let's document what we're doing and let's assess what we're doing, and let's take this seriously. Oh, that's great. That's great. Congratulations. So in terms of, one question that you might be thinking about is, okay, fine, these partnerships are out there and they're growing and there's resources to support them and there's interest in them, but really what are the benefits? Why get engaged in this way? And I've tried to synthesize some of the literature on this topic, some of which is from service learning partnerships and some from other kinds of community-university relationships. But what has been shown to be a benefit in getting involved in these partnerships? And communities have demonstrated a number of outcomes. Capacity building is certainly one, and capacity meaning being able to expand the reach in the community, the services provided, the number of clients served, if that's an appropriate measure, being able to increase the effectiveness of the organization and the resources in the community by having students, by having faculty, by having volunteers. Those are benefits that can come. It can help advance the mission of community organizations to be engaged with academic partners. They get new perspectives, they get new insights into their operations, into the work that they're doing, maybe a sense of enthusiasm by having students and having faculty asking questions and being a part of their work and being interested in what they do. There's a lot of documentation around just the kind of relationships, the rewarding professional and personal relationships that can come from academic partnerships, being recognized by being playing a role in teaching, by having a faculty appointment, by having a connection to a professional network, and not maybe feeling so isolated in the community. Access to information and research that often the academic partner can bring to bear on the work that's being done. Benefits can include funding because the partnership can lead to applications for research and program funding that maybe the community wouldn't have been eligible for without an academic partner as well. Increased credibility because in many cases these partnerships help to demonstrate the value and the validity of the work being done in the community in a more rigorous research sort of way, and that can enhance the credibility and the ability to gain funding for the work. Exposure and access to higher education. There was a great example here that I saw yesterday in Buffalo where a community mental health organization, and I guess this is true for any of the field supervisors for the School of Social Work, that they get access to college credit, to credit at the university that they can use for themselves as a preceptor or can share with members of their staff. And that was viewed as a real perk of the relationship because it's a way of advancing their education and in a cost-effective way. And then being recognized as peers, teachers, and experts. This one I really can't overestimate because one thing we found in some of the evaluations that we did is that the community partners, community groups often feel that they're not recognized for the teaching that they provide. They're not recognized as experts, and through these partnerships, they see themselves and others see them in more of a teaching role because they're supervising students or they're helping to co-lead a research project. It's more of a kind of an academic environment, if you will, and to have their expertise be recognized is a real value to them. Students, this word transformation comes up over and over again, particularly in the service learning literature, looking at what the impact of community experiences are on students. That these experiences transform their view of the world, their perceptions of differences, their understanding of diversity and leadership and policy and social change. And often the students make their observations in contrast to traditional education in the classroom. My service learning experience was completely different from, being in the seminar because I was out using my knowledge, learning new things, being in situations that made me maybe a little uncomfortable and question my values and my beliefs, but ultimately transformed me in a pretty powerful way. These experiences can help students clarify their values and understand who they are better. And understand broader health and social justice issues that really can't be taught, or it's very difficult to teach in another setting than actually being in the community. Working with diverse communities and developing leadership skills are also some of the benefits. And faculty benefit too. One thing you hear a lot, and I heard it at lunch today too, is that this kind of work takes a lot of time. It's a lot of effort. It's maybe more than teaching other kinds of courses and doing other kinds of research. Work in the community, it can be messy, it can be time-consuming, it cannot go on the strict, rigid time frame that you hope for in a quarter or a semester or an academic year. But then, on the other hand, there's so many benefits that can come personally and professionally from being involved in this kind of work. And in the outcome studies on faculty that are involved in community-engaged scholarship, it often lets them link their personal values with their professional work and values because it's kind of seamless now that they're doing work in the community. It's something they passionately believe in. It enhances their relationships with students and community members, helps them become more aware of resources in the community that they wouldn't otherwise know about. New career and scholarship directions, where maybe the research was going in one direction, but now that they've been working with a community partner, new questions have emerged that they decide to study together, and you're often running in a whole new area of research. And then, of course, access to funding and the external validation that comes from doing this kind of work as well. And then finally, institutions benefit also. And there have been more and more studies recently looking at universities that have strong service learning, community-based learning programs, what effect that has ultimately on the graduates and then back to the institution. And it can start to play a role in recruiting students and retaining them because it's seen as a desirable component of the curriculum. It's been documented that it increases alumni giving because alumni graduate with a better feeling about the institution, having had the community connection, and in particular donating to allow programs like this to continue. Graduates can excel in the workplace because of the practical skills that they get from these experiences. There's a lot of positive PR that comes from this work. And then there are things that maybe aren't what I'd put as the lead for why universities should do this, but for research institutions, having diverse research participants is certainly a goal in order to be able to conduct the research. And by having trusting relationships with community partners, they're more willing to participate in the research and be a part of that process. Accreditation, there are more accrediting bodies now that expect community engagement be part of documenting the value of the educational program. And then some of the awards that I mentioned earlier are some of the benefits to institutions. And the Kellogg Foundation has articulated what they see as characteristics of vibrant community-university partnerships. And this is from the evaluative work that they've done over several decades of studying the partnerships that they've funded. They've had some external evaluations conducted, and they try to understand what makes for these vibrant relationships, what makes them healthy, successful, sustained. And I'm going to share with you a couple examples of what I mean in a minute, but when the communities and the universities see their future linked, they see that they need each other, that it's not one using the other or take advantage of the other or gaining and not giving, but they really see their futures linked. If the University of Buffalo sees the Buffalo community, its economic vitality, its social health, its well-being, inextricably linked to the institution and its ability to function in the future. It's when that kind of relationship is established that these partnerships can exist. When they collaboratively plan efforts, when they engage in reciprocal learning, so it's not the university is the expert, the all-knowing knowledge generator, but when institutions and the people within them really truly believe that the community has wisdom and knowledge and understanding that they don't have, and together they need to figure some of these problems out. That's a vibrant partnership. When the history, culture, knowledge, and wisdom of each other are respected. And this can often be a stumbling block for faculty who maybe are new to a community or institution, and they're not necessarily aware that there was a long history of some really bad things that happened, And granted, they had nothing to do with it. It wasn't them. But unless they really understand that and kind of own that when they're in the community, it can cause some problems in establishing relationships and trust. And knowing that history and culture and really owning up to it, I think, are important parts of these successful partnerships. Creating structures, I've talked about this already, that help to create communication. It can be really frustrating for community groups that want to connect with the university but don't know who to call. What do you do? Open the book, look at the website. There's no main number to get you where you need to go necessarily. It can be very frustrating. And these structures like centers and offices of partnerships can help navigate the system for the community to access the institution. That they have high expectations of each other, that they hold each other accountable for what they say they will do and don't promise more than they can deliver. These are all some of the characteristics of vibrant partnerships. So I'm going to give you a couple examples, and again, these are examples of partnerships that have been recognized with national awards for their work. They're just examples, but I think they do illustrate a number of these points, particularly these characteristics. So one is the University of Pennsylvania and its community, its primary geographic community is West Philadelphia. And going back to 1992, actually at that time it wasn't called the Netter Center because it was only last year that they got a large donation from an alumni to help support this effort in the long run. But working off institutional funds and some grants that they were able to obtain, they established a Center for Community Partnerships at Penn. And the way they described this vehicle is in their words, that it's applying knowledge so that West Philadelphia, which is Penn's local community, the city as a whole, and the university, as well as the broader society, can benefit. And that it has three core propositions that were part of the founding of this center at the university. And it is campus-wide. It's not particular to one school. The head of it reports to the president of the university. That they believe that their future as an institution and the future of West Philly and Philadelphia are completely intertwined, that they are connected and they will always be connected. That Penn can make a significant improvement to the quality of life in West Philly and Philly as a whole, and that it can enhance its own mission of advancing and transmitting knowledge by helping to improve the quality of life in West Philly. And the center has been working now since '92 to serve some internal and external roles. Internally, it's trying to improve coordination and collaboration within. Just like many universities, very complex bureaucracies, many tentacles and parts to it that are all doing various things and marching to their own drum. And the center really is trying to understand who's doing what, help create collaborations, help provide seeds of interdisciplinary collaboration, and coordinate the work that's being done. Even though not all of it is coming out of the center, but to be a facilitating agent. It creates new relationships with community groups. It provides that voice and face to particularly West Philly in accessing resources of the university. And it's also trying to now, particularly over 10 years into its work, ramp it up to be more prominent nationally and internationally as a model, and helping to mentor other universities that want to develop similar sorts of centers. It has a governing structure that's pretty elaborate because they have a national board, they have a community board, a faculty board, and a student board that all provide input and some decision-making role in the work that the center does. But I think its hallmark, really, as a center, is that it made a commitment, and this has been a 15-year investment, and it's continuing in this track, to improving the public school system in West Philly, and in a particular model of community schools that it's noted for helping to support. And so what its strategy for change is to mobilize the university's resources to help transform traditional schools and neighborhoods in West Philly into university-assisted community schools. And the concept of community schools is that the school isn't just a place where kids go to learn from 9 till 3 every day on weekdays and that's it, but it becomes a community resource. There are after-school programs, there are social services, there are opportunities for creative expression, for culture and art, that it's a place where the public school becomes an anchor and a resource in a community. And this is the kind of investment that they're making in West Philly, working with the public schools. This is just an example. I won't read this, but there are a number of initiatives, if you want to get into details of their specific projects that are going on in the schools that this center helps to facilitate between different schools and colleges within the university and the West Philadelphia community. And it also has been developing new degree programs, majors, areas of concentration. This Franklin community is a dorm space where the students live and learn there and do service work in West Philly. And so they've used service learning, they've used community-based research, they've engaged students and faculty in this investment. And so it's an institution that's saying, there's a lot of other things obviously going on at Penn besides working with this community around public schools. But they made a strategic investment early on and a decision that we're going to work with them for the long haul. This is an important community problem that needs to be addressed, and we're going to mobilize our resources to help make that happen. It's not going to be episodic. It's not going to be just for 2 years and then we'll move on to the next hot topic. And I think that is a hallmark of this particular example. So this year alone, they've had 160 service learning courses that have links to public schools and community organizations in West Philly, involving 21 departments, 50 faculty, 1,500 students, all these children and families that are connected to the programs. And one of the high schools that they work with was cited by the state for improving its standardized test scores, which is the primary measure now for the educational attainment of the students, in large part cited because of the relationship with Penn and the faculty and student resources that have been applied there. So that's one example. And I may not have gone into that much depth about it. I mean, hopefully enough to explain a little bit about what the nature of it is. I think one thing that helped with them that doesn't actually cost money, so to speak, in terms of a lot of external sources, and is a strategy that works for a lot of institutions, which is embed this work into the curriculum, into the existing courses. Don't create a whole new structure, a whole new curriculum just to accommodate these partnerships with the schools. But one of their strategies early on was to go department by department and look at what are your courses, how might that link to a public school partner? Is there any way that, for an experiential piece of this course, it could be directed here rather than 20 other sites that you might have been considering? They really tried to focus their resources in this one community, in this one area, by tapping what was already there. And I think that helped. And also working in an area where there's public-state investment in public education, so they could tap some of the resources. The schools provide resources too. It's not by any means like this is, Penn is, it's in its generosity is funding everything. The school partners are also obtaining funds through state legislature and through state grants that they're able to apply for and that sort of thing. And I think what helped them was, and I didn't really emphasize this maybe enough, but is that over time they really documented their outcomes, and they got faculty engaged in doing research to look at what is the impact we're having in the schools, what difference are we making for the kids, and that helped them in fundraising and ultimately helped convince the donor to give money for the center as a whole. And there are, it's not just private institutions that have these endowed centers. University of Washington, for example, is a state-funded institution. Similarly, but it has to grow over time. It's certainly not something that you're going to be able to fund overnight. Sure.
What for the constituents of a program like this?
Yeah.
I understand you just said that there are metrics for them at the completion of the program, but is there a continuum? So there are so many social programs out there. Is there a handout point to another social agency? Is there a way to check back in 3 years, 5 years?
That's a good question. In particular with this partnership, I'm not really sure. I know that the schools themselves, particularly the high schools, have started to incorporate programs that were kind of incubated through the center, and then they continue them on. But, and it's always a risk when I'm using examples like this that I don't know every single detail about them. But I would say Ira Harkavy is somebody you might want to come spend some time here, because he led this from an undergraduate student at Penn. The seed of this center was born or planted, I should say, and he leads it now. So he's got the whole history from the very beginning. But I don't know so much about the broader community organizations, but within the schools themselves, I think this center forms kind of like an incubator for new ideas, and then the schools take it. And there's one program in particular that has to do with community gardens in the schools, so that kids get experience both running a garden and kind of running a business, and they use it as a basis for nutrition and health counseling. That the state has now picked up on it and is distributing it to schools around the state, so it's not just happening in Philly. So that's another maybe replication strategy. Are there other questions or thoughts? The other example I have, a little bit different example, but I think also one that demonstrates some of these principles, is a coalition that was really focused on diabetes. This is in Charleston, South Carolina, involving the Medical University of South Carolina, which is a health sciences campus. And the mission of this coalition, which has community and university involvement, is to eliminate disparities for over 12,000 African Americans with diabetes through a variety of strategies: community action, health systems change, and collaboration. And what they were really trying to work on in this collaborative effort is to decrease disparities in diabetes care. In this community in particular, there was a very, very high rate of amputations among African American men with diabetes. And so this effort, maybe unlike to compare with Penn, which really centered around improving public education, this was a group of community members and faculty that came together around this issue of health disparities in the African American community, specifically in diabetes, but knowing that many of the risk factors for diabetes carry over into other areas as well, so it would have hopefully a broader effect. And the partners very much involved area churches. The faith-based community has been key to this partnership. Community centers, work sites, some really interesting involvement of libraries, public library systems. And then the College of Nursing really took the lead, and they formed a board, a representative board of community and university people. And a little bit of history. So it formed in 1999, this coalition, and it's trying to work on community education, changing the healthcare system through policy. And I included this because it said a sound business plan, and you often don't see this in partnership descriptions, but right from the beginning they knew that even if they got some grants to help support their efforts, they needed to have a business plan to really sustain the gains in eliminating health disparities, that it couldn't just be dependent on grant to grant to grant. So they started a business plan and kind of a fundraising plan from the start. And the history behind this partnership is that in the mid-1990s, at that time, and maybe they're still called enterprise communities, as designated communities that were disadvantaged and could access certain federal resources. The leaders in this community found out about Carolyn Jenkins, who's a faculty member at the Medical University and the College of Nursing, and they wanted to get her involved in their work. They'd heard that she was community sensitive and interested in community health issues, and they really wanted a needs assessment conducted because they wanted to try to build a health clinic and maybe do some things around health, but they knew they didn't have the data and they couldn't justify it, and they wanted some research done. So she started working with them. Ultimately, they documented the needs, the disparities. They were able to open a community health center. with a community board. And so this is an example of relationships that started. It wasn't because of a grant. There wasn't money dangling in front of anybody. There was a need, there was an interest, there was an opportunity for scholarship too, and they came together and started working together. And then several years into it, the CDC comes along with a major source of funding for diabetes and obesity prevention issues. So they decided to apply for the grant. They already had that relationship, and they had a good foundation of baseline data. They were awarded the grant. They completed the assessments. They started developing programs in the community collaboratively with all the partners that I mentioned. And then just this last year, they were awarded a subsequent grant from the CDC for the next phase of this initiative, which takes it to scale with other states in the South that they're collaborating with. And so this is just some example of some of the programs. They're really focusing on several levels. They're looking at improving education in the community around science and health literacy and diabetes in particular. They're involving community health workers, lay health advisors, people in the community who are trained to be diabetes educators. They trained local librarians in helping people access information, because one of their findings from their assessment was that people in this community tended to go to the public library to access information. They didn't have internet at home. There weren't a lot of computers and other resources. People tended to use the public library, so they got them involved. They worked with local health providers. One big area for them was trying to understand some of the issues around racism that were occurring between primarily white practitioners, primarily African American patients. There were a lot of issues there that they started to unpack and address. And then they also started to advocate for policy change, and one of their big targets was the Medicaid program in the state, which didn't adequately fund diabetes education, and if they wanted to sustain this kind of community education effort, they really had their eyes on Medicaid to help pay for it. So they documented impacts, and probably the most significant was having the number of amputations, or the percentage of amputations among African American men in this community through the efforts of this coalition. And they also changed the Medicaid reimbursement policy, and they were successful at getting a more sustained source of support for at least part of what they did. And then there's also the academic impact. And, with community university partnerships, you have to look both at what was the impact in the community, but how did the university change? What were the benefits to the institution of being involved in such an activity? And here, the areas of service learning and scholarship were really pretty impressive. They had hundreds of students involved in these projects as part of service learning courses that they were taking. They had interns from other universities that got involved, also high schools. This is data from a couple years ago, actually, so I'm sure the numbers are higher now, but they had 4 doctoral students that completed dissertations based on work going on in this community, lots of presentations in the community, and more traditional academic publications. But they were able to demonstrate impact both in the community and in the university, and leverage resources for continued work and even expanding, to the other states, as I mentioned. But as I said at the very beginning, the predominant model is not necessarily this kind of partnership that I'm describing in these 2 examples. That often these relationships are driven by grants, they're driven by academic requirements. We need to get so many students out in the community for a practicum, let's find the placement sites. It's not really a partnership approach. And that the community building and the social justice issues are often not at the forefront of why people are engaging. But we have learned a lot over the years about what works and what's not working. And there was an interesting meeting that we helped to convene a couple of years ago of community partners. These are leaders from community organizations around the U.S. who all work with university partners in some way. And we brought them together for several days for a wing spread meeting to find out from them what's working from your perspective. There's a lot written and a lot said about these relationships from the university perspective, but let's hear from you, from the community partners. And we found that, and a lot of these findings are not huge surprises, and a lot of it's very intuitive, but for them to articulate it clearly that, trust and honesty and relationships of mutual respect, that we all own what the work is. We heard some horrific examples, very sad examples in a lot of ways at this meeting where, for example, one partnership had been recognized by a really prestigious award at the national level by Health and Human Services, and the academic partners went to the meeting, accepted the award, never told the community that they were even getting the award, and they found out about it by reporting in the local paper. And so examples where, is it a partnership? Doesn't seem like one to me, if that's how they're approaching, the response to recognition in that way. But what the community partners said over and over is, for this really to be authentic, for this really to work, it needs to be genuine. It needs to be, we're in it together, we're making decisions jointly. It's not necessarily the case that the money has to be split absolutely evenly on a grant, something like that, but that it needs to be equitable. The funding needs to flow to who's really doing the work and who's responsible for the activities. Systems need to be challenged. It's not enough for the faculty member to say, well, the university is going to take 60% indirect, so that's the best we can do. But can that be challenged? Can it be asked? Why? Is there a way of having some of that funding come back to the partnership or to the community partners? And in some cases, it can. So we heard from their perspective about what's working, challenging the system, so to speak. When communities gain transferable skills, when the community members are trained as lay health workers, when they have research coordination roles in a grant, when they're co-principal investigators of a project, that they're building their skills and their capacity, and it's not only the infrastructure and support being built in the university. And we also learned that what's working, and this has implications really for any university that has community partners, is the networking that can happen when you bring the partners together in the room. When the partners sit down together to talk, they share with each other what's working and what's not, and that builds capacity too. And what's not working, there were a lot of examples of what's not working. When proposals and ideas are developed and the community is not engaged from the beginning and are brought in after decisions have already been made, when decisions are made behind closed doors, when grants require that community be involved, but the funding entirely goes to the institutional partner. When researchers or any academic partner isn't really culturally competent or competent to be in communities. And it was said over and over at this meeting, not every faculty member needs to be engaged, and not everyone should, because it's not necessarily what everyone is cut out to do. And so what's not working is when there's kind of a force fit with having to partner with someone that maybe doesn't really want to be there. No planning for sustainability. When the community doesn't have the infrastructure to engage, to expect partners to be at meetings and involved in activities when they're not being paid for it, or when it's not part of their job description, or when, frankly, they're just so strapped with the day-to-day work that they're doing in the community and not acknowledging that. So there were a number of things that weren't working. And the group came up with what I think is a helpful framework for authentic partnerships, just principles to consider. That we're not just talking, and this is a direct quote, we're not just talking about a process that involves partners. There needs to be a process of shared decision making. And so, to have a community advisory board or advisory structure is fine, but to have a board that really makes decisions and helps advance the work by making decisions is more of a true partnership. That there need to be meaningful outcomes that communities care about. And this was a quote from a woman at a community health center in Washington State who said, and she does a lot of collaborative work with the University of Washington, mostly around research on the migrant health issues. She said, okay, we can work together on community-based participatory research, and it's important to do research, but only if you support our kids in the pipeline. Bring them to campus for programs. Teach them skills they use to be more marketable. Give them academic credit. And so for her organization, playing with the academics for research, it's important. They need to learn new knowledge to better their programs and understand migrant health issues. But at the same time, right now, her Hispanic kids in her community are not graduating from high school and are not getting into college and are struggling with school. And so that needs to be on the table, too, as part of a tangible outcome that her community it needs. And then lastly, that there needs to be transformation, and that for partnerships to really be true, authentic, and meaningful, they need to change the people involved. And it's not just about change in the community in various ways, but the institution involved needs to change also. And so the partnerships that are really thriving, and this kind of goes back to the Kellogg principles I had up earlier, need to be transformational for all involved. CCPH developed a set of principles early on when we started the organization, and they were updated a couple of years ago after an iterative process with our membership. And I won't read these, but just I think a lot of what I've been talking about is reflected in these bullet points. There's a second page too. But what kind of characterizes partnerships? And we found a number of partnerships have used these. We don't recommend at all that a partnership just take these and adopt them, but it's the process of talking through, what do these mean? If you're working in a community or you're a community person here with an academic partner, to sit down and talk through, are we doing these things? How are we doing in these areas? It can open up some real important avenues of conversation. And these are a few more, including the last one, which was a new one in the last round of updating this, that partnerships can dissolve and need to plan a process for closure, because it's not necessarily the case that partnerships need to continue forever. And just like any relationship, you might describe that way. But that there needs to be a plan to celebrate, to reflect on how things went, and then, if it makes sense to go your separate ways. There are ongoing challenges to this kind of work, including distrust of academia that many communities have, unequal balance of power, unequal distributions of funds, being resistant to change. Scientific rigor versus community acceptability is a big issue in research, where the community may not want the design the way the traditional academic would want to see it done, but yet there are ways of modifying the study design, for example, that can be acceptable to both. Review, promotion, and tenure policies for faculty can be a big challenge for some that want to do this work as really the centerpiece of their career, and so forth. And as I wind up here, in terms of success factors, just as there are challenges, and there's no doubt that there are many here, there also are factors that contribute to success. That when, just as in the two examples that I gave around public education, around diabetes, that when the relationships are formed to address a genuine need that people care about, that's a strategic issue for the partners involved and not something ancillary or add-on, not for the sole purpose of getting funding, when it builds on trust, when there are prior relationships, when there are structures in place that help to support the work, when everyone is benefiting in some way, these are all factors that contribute to success. So I wanted to end with just maybe a few thoughts on, what can campuses do and what can communities do to help advance these concepts in their own work? And I think some of this work, some of the foundational work has already been done at UB, so this isn't directed specifically at the university here per se, but just in general, how to think about some of these things. And what campuses can do, and where they often start, is doing an assessment of what's going on our campus, who's working in the community, what are the current relationships. Let's start with where we're already working and build from those strengths and build from those relationships. Let's look at our mission and our strategic plan. How can community engagement, community partnerships advance them? How can they further them? If, for example, at the University of Washington, one of the last president's major initiatives was around engaging more undergraduate students in research. Okay, fine, but not all that research has to be done in a laboratory. What about community-based research? And the folks on campus that do community-based work went right into that president's office with a proposal for, this is how we can engage undergraduate students in community-based research and help train future professionals to be community involved. But it was keyed in right with what the president's strategic plan was. It wasn't to do something else. It was focused on what he had outlined as a major priority. Reviewing funding and accreditation requirements. There are more and more professions now. The Midwest colleges and universities, I don't think this applies here, but there are a number of states in the Midwest, the accrediting body now requires community engagement. So looking at those requirements and seeing how can this work help advance that. The curriculum, are there courses, an example in dentistry, every school of dentistry has to teach dental public health. Many of them teach it in a classroom kind of seminar design. But if you really want students to understand public health issues and oral health and communities, service learning, community-based learning is a wonderful vehicle for doing it. So if I were looking at the dental school curriculum, for example, and I saw that course and its objectives, well, that's a place where service learning and community engagement could really enhance it. So it's not creating something new in a whole new course, but let's look at the curriculum. Where are there opportunities to really advance the goals through community engagement? And the same for research that's being done. Creating or enhancing existing support structures. I talked with a woman here today, Zoe, where did she go, who mentioned to me that she's involved in field placement and social work, and she's finding her counterpart in other schools and colleges on campus, so they can come together and start strengthening their efforts, because they're all placing students and all working with partners and all trying to figure out how to do it well. And there's also the potential for interdisciplinary community experiences for students if they communicated with each other. So that sort of creating or enhancing supports is important. And what can communities do? There's kind of, on the comparable side for the community to look at, particularly organizations, community coalitions, and groups. What relationships do you already have with campuses? Are there faculty already bringing students to you? Is there a research project going on in your agency that involves a faculty member? There may be things going on that could be connected to other parts of the work that you do and built upon. And the same, like with institutions, the mission and strategic plan. If part of the mission is to implement evidence-based practice in my agency, well, maybe a campus partnership would help enhance that. If I had graduate students who were able to do lit searches on the literature in my field and let me know what the best practices are from what's been published, because I don't have enough time to read all those journals because I'm doing the work day to day. Are there licensing certification requirements that a campus partnership might help to meet? For example, so many more funders now are looking at outcomes, or looking at evidence. They want to know that what work is being done in the community works, and that's a logical, natural potential partnership with academics in terms of studying what works and having the questions be designed by the community. And then I think this one's really important, to identify conditions under which you will and will not engage in campus partnerships, because I think more and more now community groups are getting savvy to the power that they have in these relationships, that getting a call 3 days before a grant's due for a letter of support, that doesn't fly anymore. That no, I think it's wonderful when a board of directors of a community agency or the community leaders involved can sit down and really think through up front, proactively, before they approach an academic partner or before an academic approaches them, what are the conditions under which we'll be involved in this kind of work? What do we want to see come out of it, and how do we want to see the process go, so we ensure that it is a partnership and that we're not taken advantage of. And then, of course, what both can do is have dialogues with each other and talk about these issues openly, and to engage in collaborative planning, some of which I think will happen at a session we're going to have tomorrow. Excuse me, and to become involved in this movement. The Community Campus Partnerships for Health is one organization that's involved in these issues. Campus Compact, I mentioned, is another. But these are venues where there are national conferences, there are workshops, there are meetings, there are listservs, there are training institutes, to be able to connect up with others that are working in this area and to learn from the work that's already been done. And so I'll close just with a few resources through CCPH, things that are coming down the pike that I thought I'd mention since they're timely. This may seem a little bit out there from what I've been talking about, but we recently finished a grant that looked at how can you get communities more involved in decision-making roles in clinical trial research. In kind of the gold standard research in academic medicine is the clinical trial. And we really wanted to see, is it possible for communities to be more involved in a participatory way in the design of cancer clinical trials in particular, where there's a lot of community activism and advocacy around cancer. And if you go on our website now, there's a call for proposals for groups that want to try to implement recommendations from the report that was released from this project. So that's kind of a pretty specific thing, but it is a resource available to help link communities and clinical researchers in partnerships. The award that I mentioned that both Penn and the Medical University of South Carolina received is an annual call for nominations that are due in January, and you may be involved in a partnership. It can be a campus-wide, or it can be a very focused, narrow partnership between one faculty member and one community organization that's eligible to apply, but we're always looking for nominations for that. Our big conference next year is in Milwaukee, so it's not too far, and the whole theme is on transformation through community-university partnerships. The CCPH board, which is community and academic members on it and students, is going to be issuing a call soon for new members. So if any of what I've talked about, if these are issues that you're interested in, that you're passionate about, that you'd love to see expanded more across the country, consider applying to be on the board, because it's a chance to really think about these issues at a national level and have some impact on them. We have a lot of discussion groups on different topics, electronic email discussions on community-based research, on service learning, on ethical issues in these partnerships, and you don't have to be a CCPH member to join them, so that's a way of connecting with people around the country also. And then we have a couple of toolkits that I wanted to mention that are also on the site. One is kind of a tutorial for how to develop and sustain community-based research partnerships. And then one is very focused for faculty members on how to make the best case for promotion and tenure when they do this kind of work. And it's got examples of portfolios of faculty members that have been promoted. And we developed that because of faculty that were concerned about how to best document their work so that it would be recognized as scholarship. And so I think these slides are going to be posted on a website. So this is very tiny print, but a number of reports that form the basis of some of the comments that I made today. And again, just to join a growing network of community and campus leaders that want to see these partnerships thrive and sustain and have the kind of impact that they have the potential to have on the issues that we care about the most. So thank you for your time, and I look forward to questions and challenges you might have for me in the few minutes we have left together. Thank you.